Our first speaker this week is Dr. Julie Doniere from Milwaukee. Hi Julie, before we get started with talking with her, I'm just going to let Jessica introduce herself as well. And Jessica, if there's anything that you want to share before we start, now would be the time. Jessica will also be chiming in a little bit here and there throughout this, and helping me keep track if there's individuals that want to ask questions. This is the time to do it too. So we do have a chat on here if you want to ask questions. I do believe there is an option too to raise your hand in Zoom if you do have a question. Feel free to do that. Any questions for Julie or Jessica and I is welcome. So Jessica, if you have anything to add before we start.
No, just I'm super excited to see so many people logging in, and I thank Dr. Julie for doing this with us. This is really important, and it's a really important time right now in our state and nation to be able to come together. So thank you so much.
And just to give everybody a heads up too, so since we are doing these Q&As with individuals across the country and the state, I am going to be recording these so individuals can go back and watch them, or people that weren't able to jump in. So these will be recorded, so just to give you guys a heads up on that. So with that being said, we're just going to jump in here and bring in Julie. And so Julie, if you just want to give us just a quick overview of yourself and the work that you've been doing in the field.
Thanks, Wes, and thanks, Jessica, for letting me be here today. This is exciting, and let me know if you've got any questions for me. My name's Julie. I know underneath my name it says Timothy. My husband and I are sharing a computer to do all of our Zoom meetings, so I'm actually Julie. I'm not Timothy. I am an ER doc. I work in Milwaukee, Wisconsin, serving St. Joe's, St. Francis, Franklin, All Saints, and Elmbrook hospitals. And we've been seeing a ton of coronavirus recently, and that's why Wes and Jess asked me to come just to talk about my perspective. And let me do a disclaimer. I am just an ER doc. I am not a CDC. I'm not a scientist. I am an ER doc. So all the information I'm giving you today is from my perspective as an ER doc from Milwaukee. So thanks for being here today. I know that we've all heard about this, and I just wanted to do a quick explanation of what this virus is that we're working against here. And you probably heard two terms: coronavirus and the COVID virus. The COVID virus is the most recent name of this virus, and it's named because it's a coronavirus. That's a CO in the COVID. The VI is because it's a virus. The D is because it's a disease. So COVID comes from the fact that it's a COVID virus. You might have heard that there has something to do with China. Nothing to do with that. It's all named so because it's a coronavirus. It's a new virus. You may have heard the term that it's a novel virus. That just means it's new to us. It's probably not new to the world. It's probably been hanging out somewhere where it just hasn't spread as rapidly, but it's new to us, and we're finding new things about it every day. I've been on the CDC website daily to learn more. It's been an exciting time to be in medicine because we've never had anything like this before. We're learning more things about this virus every day. And I'd like to share with you just a little bit about what we know about it. Number one, it's really, really contagious. It spreads person to person. So you've obviously heard that we need to stay 6 feet away from each other outside of our house and stay in our house when we don't, unless we need to be leaving. It's spread by respiratory droplets. Also can be from contaminated surfaces, so you can get it from surfaces. It's so contagious because it can last on surfaces, and people are contagious oftentimes when they don't even know they're contagious prior to symptoms starting, or people can have this disease and not know they have it because their symptoms are so minimal. As of 4 p.m. yesterday, the total number of U.S. cases is 16,539. Those are documented cases that have been tested positive, and the total amount of deaths in the United States is 2,860. Wisconsin, we've seen 1,221 confirmed cases. Now, let me be clear about something. That's confirmed cases. We are not testing people in the emergency department for this virus. Here's why. Testing is very limited. So we are only testing people we are only testing people in the emergency department if they need to be admitted to the hospital or if they're a healthcare worker, or they multiple comorbidities. So oftentimes what we'll be telling people, your symptoms sound like this is what you probably have. Go home and stay by yourself. Wes, is that a good enough initial background? Anything else you want me to specifically speak to?
Yeah, I think that's good. I think, there's been so much out there about, the COVID-19 and so many different, facts and things about it. So just giving people a brief overview, I appreciate that. Would you want to just quickly touch a little bit about yourself then, on your background and kind of the specialty that you, as far as being an ER doc, and so a little bit about your background, and then jumping into, the ER's current role, I guess, specific to Milwaukee, what you're seeing there. And as far as the COVID-19 cases that are coming in and different protocols that the ER is taking.
So my background is, I'm just an ER doc. I've been an ER doc for 24 years and I love it. And one of the things I love about being in the ER is that we see everybody. We see everybody from sniffles to dying, in all walks of life. However, the last 2 weeks have been a huge change in that our usual mantra is, we are here for you, come in. Our mantra now is, unless you are really, really sick, for goodness sake, stay home. And here's why. The ER is a huge place to catch this virus. We have waiting rooms that people wait in. We have rooms that people are in and out of. So the message I want to get across, while the emergency department is always here for you for emergent situations, for the time being, the emergency department is for life-threatening problems. So what I would like to have this discussion be today, because specifically for the audience today, is we have been, specifically in our ERs, we have really been trying to help people who have substance abuse issues and welcoming them in and being a place for referrals for them. Right now, the ER is not a very good place for that, because number one, it's contagious, and number two, our aim is to get people in and out as quickly as possible. The time that we want people in our ER, we want it to be minimal. We either want to get them admitted to the hospital or we want them back home because of the contagiousness of this virus. That being said, if somebody does come in with a substance abuse issue, we are still doing what we do in the ER with a little twist. We do have recovery coaches respond to our ER on a normal day. However, what we're doing now is, because we want to keep our recovery coaches safe and people safely apart from each other, we are doing those phone consults. We're doing those consults by phone. So that has changed a little bit. We are, just to let you know, to kind of update you what's going on with the virus specifically, we are seeing people who are significantly ill with this virus. So it is real. And again, I'm not a CDC. We're all following New York. I think we're really going to see a pretty big spike in the next 2 weeks or so. But the ER right now is not a safe place for people who are healthy, because their risk of contagion goes up. So our big change in what we're doing is people in and out. We are not, I want to get the message that we are not testing on a regular basis for COVID virus in the ER. It's not part of our protocol. If you come with symptoms and your oxygenation is fine and your vital signs are fine, we are going to say send you home, you probably have it. For testing sites, those are changing daily. So I can't give you specifically where to go, but if you do have a primary care physician and you're having symptoms and you want to be tested, my best advice is to call a primary care physician and they can order the test at a site away from an ER. I wish I could be more specific, because that's changing every day where that's happening. But my best advice is to call your primary care physician. If you don't have a primary care physician, I know that if you call Ascension, specifically as the hospitals that I work with, they have prompts that will tell you where to go to figure out how to get tested. That's it.
Awesome. Thank you, Julian, for touching on that. I know you mentioned a little bit briefly that your hospital system in Milwaukee there is part of the ED2 recovery program. And I actually, that's how I met you, was through that program. And if you want to just kind of give a brief overview of, for individuals who don't know what that is, when that started within your ER and how you heard about that. And then I'll jump into a few more questions about the ED program with what's going on in the COVID-19.
How I learned about ED to recovery is I was at a meeting in Madison, and Jessica was talking, and I was just in a crowd of about 100, and I thought, holy crud, and she was talking about this ED2 recovery, which is the program where people respond to the ER, peer support. People come to my ER, can come to my ER and talk to people, because my big I had been so frustrated by the fact that as an ER physician, I was having a difficult time connecting with this specific patient population. Number one, because I don't have lived experience. And number two, because for referral sources, that was always changing. And I felt like I was being an inadequate physician by giving people a piece of paper saying, this is where you can follow up for your substance abuse. So I heard Jessica speak and I was like, woohoo, we need that. So I looked and found a grant. So we wrote a grant and got the grant to get recovery coaches in our emergency departments. And that was in October of 2018. I was very excited about this and just applied for the grant myself, and then realized very quickly that I couldn't handle all the grant parts of it. So then I was put in partner with Jessica. We became partners with Wiz Hope, which is the recovery coach group that we work with right now. And so they have multiple recovery coaches that we will put in. If somebody comes in and they have substance abuse issues, we write an order, a phone call goes out to the recovery coach, and within an hour that recovery coach comes to my ER to talk to the person in the emergency department about their specific, where they are with their recovery right now. If they are interested in talking about recovery, if not, how can they help them in other ways? It's been very gratifying. It's been going on for over a year. Been gratifying on a couple levels. Number one, I feel like we're actually giving people help. Number two, I've met a wonderful group of recovery coaches who have been inspiring to me, and I think it's been a big part of their recovery too. So it's very important to say this is still going on, and we're still doing it by phone to keep everybody safe. But I think it's been one of those gratifying changes we've made in the ER in the last year. I've had nurses tell me this is the most exciting thing that's ever happened to them in the last 10 years, because they're actually able to give good help to people. So I really appreciate ED2 recovery. It's been a great thing for us in our emergency departments.
Awesome. Thank you for touching on that. I think, so the big thing that I think about too right now is, with this COVID-19 pandemic that's going on, and, the stay safe at home orders and things like that. COVID-19 is such a huge, of course, global spotlight right now. And just thinking about and seeing and hearing that individuals that struggle with substance use and mental health, it's still a pretty big deal, and individuals are still suffering with that, especially the isolation piece. Have you seen within the ER or the emergency department any increase in individuals that are coming in due to substance use or overdoses, or what is the protocol there with the ER now, since COVID-19 is such a huge thing right now of individuals probably coming into the ER? When somebody comes in with that's presenting with substance use or an overdose, has there been a change in protocol on the ER's stand and how that is handled?
No change. Except for the big thing that now the recovery coaches are by phone. If somebody comes in requesting help, somebody comes in requesting help, we'll still have our social workers see them and give them referrals. We'll still try to see if we can get inpatient if they need it. That part has not changed. We have seen a decrease in people coming into the ER, which actually is good because, it's good because of from a contagious standpoint, but I think it's not good in that I'm afraid that people aren't looking for help in this time. You're exactly right. Isolation is while it's important for this disease, is bad for other diseases.
Yeah.
And that's why I'm so excited that you and Jessica are doing this, to talk about what people can do instead of going to the ER at this point, because reaching out is so important, and isolation can be such a hard part of so many illnesses, including substance abuse and mental illness at this point. It's really important that you are still heard, and that you are realizing that medical assisted treatment, that kind of stuff, is still essential, that is still open, that will still be happening. So my advice would be call either numbers that you guys can give to get some direction of where to follow up with, because it's so really important not to put this on the back burner, because this kind of horrible catastrophe that's going on with COVID, I know, can be a trigger for so many things.
Dr. Julie, can you tell me like how much of a reduction you're seeing in substance? You said it's a reduction with people coming in for substance. Can you give me a flavor for like how much of a reduction? I know that's probably hard because you're not everywhere, but just interested to know that.
Yeah, I can only speak anecdotally in that our numbers in general are down because people are staying out. I can't give you the exact numbers except to tell you in the last 2 weeks it's down. And I don't have access to tell you exactly where that is, but I can tell you, and specifically with overdoses, that is such a up and down thing, depending on what's out there. Some days we'll see 10 overdoses in a shift, depending on what's out there, and then we won't see some for a couple days. So, and that also is geographically changed. Like some days I'll see bad ones at St. Francis. It depends on where that bad stuff is. So that's a horrible answer, but I can just tell you that generally the numbers are down.
Okay, no, it's a great answer, and I appreciate you doing this. I work with Rogers, and we've just seen a downtick in our admissions for addiction and that kind of thing, and it's interesting to see how it flows to us from you and that kind of thing. So thanks for sharing that.
And if somebody does come to the doors requesting treatment, specifically wanting inpatient treatment, we're still doing the same stuff. Just to be very clear, we're still doing the same stuff. Our social workers are still doing the same. We're medically clearing. We're trying to get people help when we can.
Dr. Julie, there's a question that popped up in the chat, and I'm glad that Kim as well as Janet from Rogers are both also on this call. But so Emily is asking, so if individuals are encouraged not to go to the hospital, what resources are available in our state for detox, and what are the recommendations surrounding detox and recommendations regarding how long or how to access detox? And I know others have also asked the same questions about someone going in for like inpatient, or going to Rogers and such like that. Do they have to pass screening? Like, are they supposed to get some places won't allow them in unless they can say that they don't have COVID, but there's not enough tests to go around to prove that they don't have COVID.
That is changing daily, and that is site specific also. So I wish I could give a blanket answer, but I will be honest with you and tell you that if people are having respiratory symptoms, some inpatient psychiatric units and aorta units do not want them inpatient for obvious reasons. So I think the best answer I can give is to make the phone call, start the conversation, and see what's going to be best for you. We are handling it differently at different sites. At All Saints and Racine, sometimes if we really feel like somebody needs admission for substance abuse issues, we talk about bringing them in the medical unit until we can get them somewhere else. I don't know if that's happened, but I know that's been part of our process of talking about what we're going to do. Each site is different, and we're going to make sure everybody's safe. That's the best answer. I just want people to know that I don't want them to take that as don't seek treatment at this time. It may be a little different, and it may mean more phone calls and trying to figure out where the best place is to go, but there still is treatment available.
Awesome. Thank you, Julie. Are there any other questions that individuals want to ask Julie right now? I do see there's a couple other questions specific for inpatient. I don't know if there's some other individuals on this call that would want to touch a little bit on that, maybe some protocols so individuals know what some of the local inpatients or detox units are doing right now.
So I'm Kim. I work with Rogers Behavioral Health, and yeah, we're certainly open for business, full throttle with all of our levels of care. Inpatient, that includes detox. So you would just call the usual channels to do the admission, and we're open for partial hospitalization, intensive outpatient treatment, and also for residential. And some of those waiting lists are quite short right now, just due to people being concerned about going in for treatment. So this is actually a great time to get treatment, and we have turned over a lot of things to telehealth as much as we can, and certainly are practicing social distancing as needed in the inpatient units. If somebody doesn't have access to internet or appropriate devices to do telehealth at home for PHP and IOP, we can have them come in, and then they will still be doing telehealth. But at least we can provide them with an internet connection and or devices as need be. And we certainly are doing that in inpatient and residential as needed too. So just obviously practicing all the things we can to keep people safe, but still remaining up and running as needed. So to do the admission, you would just go through the usual channels, and we have people ready and waiting to take the calls. So yeah, happy to be of assistance. If anyone has questions, I'm happy to reach out to them directly too. If they need my information, I can leave it in the chat box, and they can just reach out with specifics as they emerge. So thanks for asking.
Thanks, Kimberly.
You're welcome.
Do we have any other questions specific for Julie right now that anybody wants to chime in since we've got her here? Nobody?
And if no questions, can I just say quickly, thank you,
Yeah.
thank you to all who are doing your social distancing. You are saving lives by doing that. I know that a lot of people here on I'm seeing the names are medical and you know all this. But right now, working in the ER is the first time I've ever been scared in 25 years of working in the ER. So the best thing anybody can do is stay home and stop the spread of this. Right now, just to let you guys know, because I know there's a lot of rumors, we're in good shape in the ERs right now. Milwaukee is very safe. My worry is that if we get a big surge and we won't be able to help people appropriately. We're not at that point right now. But what's going to help us stay under control is people continuing their social isolation and keeping your travel to a minimal if you need to. There's been a lot of questions about face masks that the only reason I'm bringing it up is that this is something people ask me in the ER all the time. Should I be wearing a face mask when I'm walking around? The CDC is actually kind of on the verge of giving an opinion on that. I would say if you are feeling ill and you have to go out, you should for sure have something covering that face. Something to cover the droplets if they'd come off. The face masks actually work better for somebody who is sick to not come up to not give out the virus. So it's just important that if you are ill to make sure that face is covered.
Thank you, Julie. We got a couple minutes left here. If anybody else wants to ask Julie some questions specific to the ER or even the ED2 recovery program that is in their hospital, right now would be the time.
Julie, I just received a message from Tina Perry, who was on the call. She said she can't figure out how to post this, but she wants me to let you know. Thank you for continuing to work in the ER and the service to the people that you serve. From her, you are in her backyard. She lives and works down there.
Oh, well, hi Tina again. Nice to see you, or nice to hear from you. And thank you guys for continuing to do what you're doing at this time. This is such an important time for mental health and to continue to support. Thank you for still being there. If you guys, through Jessica or whoever, figure out any ways that you think we can continue to support people through this time in our ER better. Jessica and Wes can always share with me if you have any ideas. We want to make sure that through this, we continue to serve everybody's needs.
Yes, and thank you. Tina said too, thank you, Julie, for everything that you do. And, I've known you for a few years here, and the hard work that you do at the hospital is much appreciated, not only within the community, but within individuals coming in that are struggling with substance use. And I know since that program has been there, it's really, taken off and helped so many people in so many ways. So we appreciate that. And I appreciate you jumping on this call with us today. And if there's, what I'll end up doing, like I said, I'm going to be posting this video on our platforms. And if there's any other questions that individuals have, feel free to just shoot us a message, a private message. And then we could connect you with Julie if you have certain questions with her or regarding questions to her. We'll be able to do that for you. So.
And I'm seeing one more question from Emily. Emily asked if we send people home with Narcan. We send people, St. Joseph's, we have a grant that we do send people home with a Narcan kit after overdose. I'm looking for money to make that happen at my other ERs. The other ERs, I'm asking my physicians and mid-levels to make sure they are given a prescription for same and tell them how to get it filled. But right now, St. Joe's is the only place I can actually give a kit to people because it's the only place I have money. I continue to look for money so we can do it at all our ERs.
Jessica, did you have anything else you wanted to add in?
No, just thank you all for joining us, and thank you, Dr. Julie, for just being amazingly you.
Yeah, and just so everybody knows, this is going to be a weekly thing for the foreseeable future, as long as, and maybe even after this pandemic ends, and hopefully we can bring on more individuals that can really give out some solid and good advice to everyone that's in the field, as well as people in recovery. So every Wednesday, we're going to be doing this at 1 o'clock. We do have a pretty good lineup of individuals that are coming live with us. So feel free to, I know you probably have seen the posts for this on our Facebook. Check into those for the next few weeks here of individuals that we're going to be bringing on. So again, Julie, thank you so much for joining us today. And if anybody has any other questions, feel free just to reach out to us.
Stay safe, everyone.
Thank you.